Auditors say the amounts lost could be higher than even the 5 billion shillings stated, since they are yet to complete work on the ministry's transactions for the year. The report, addressed to Health CS Cleopa Mailu, says up on the list of fraudulent transactions identified in the audit report was the diversion of 889 million shillings meant to be disbursed to county governments to support free maternity care programs, and its use in the purchase of phantom mobile medical clinics for urban slums that have not been delivered to date. 800 million shillings was paid to Estama Investments Limited, a company whose owners are not revealed in official records at the Registrar of Companies, to supply 100 portable medical clinics that have yet to be delivered 4 months after the financial year ended. Even more questionable is the fact that Estama raised a separate purchase order for 200 million shillings on June 30th and got paid the same day. Not a single of the clinics meant to boost access to healthcare in urban slums have been delivered to date. Speaking to the Business Daily on phone, the Principal Secretary in the Ministry of Health, Nicholas Muraguri, did not deny the existence of the audit report, but dismissed the author as incapable of understanding how government works, even as he threatened with espionage and snooping on private communication. Other entities that received the cash include Esaki Limited, a company associated with former Ethics and Anti-Corruption Commission Chairman Philip Kinesu, which was paid 150.1 million shillings of the diverted funds. The ministry's Global TB Fund Round 5 was paid 118.1 million shillings, Vivo Limited 18.7 million, Director KMTC 66.5 million, and Director KEMSA 25 million shillings. The audit says a whopping 515.7 million shillings was lost through outright theft and double payments made under the National AIDS Control Program. The amount was ostensibly used to buy food and rations whose storage or use the audit could not confirm. Some 265.7 million shillings of the total amount was paid to Cooperative Bank. The auditors have particularly flagged irregularities surrounding the procurement, noting, for instance, that while goods were purportedly purchased and paid for at the ministry headquarters, the same were received and stored in KEMSA warehouses, where a parallel procurement for similar goods had been made, making it difficult to probe the two and raising the prospects of possible double payments for the same supply. The ministry also closed the financial year 2015-2016 with 2.4 billion shillings pending bills, which the auditors found to have mainly come from illegal overspending. The ministry, for instance, spent in excess of 413.6 million shillings to construct buildings, partly aided by illegal expansion of authorized allocations by a massive 350 million shillings. The audit says ministry officials manipulated IFMIS to effect the fraudulent transactions, where 2 counties and 10 farms were paid money that the report says was not intended for the allocation. The trail of payments is spread countrywide, pulling in Bungoma and Lamu counties, which received 100 million shillings each, while Liesl Chem Company was paid 28.6 million shillings for construction of buildings. Other recipients of the money were Minray Medical Kenya, Bulekon Associates, and McCoy Consultants. The report also points to loss of millions of shillings in grants to the Kenya Medical Training Center, where the ministry overspent 268.8 million and presented records that were in conflict with the electronic trail available on IFMIS, pointing to fraud. KMTC's record shows it has pending bills of 184 million, while the excess expenditure is captured on IFMIS at 268.8 million shillings. Mercy Juma Okande, NTV.